Well, November is Lung Cancer Awareness Month, and the American Cancer Society just released new screening guidelines to try to catch the disease earlier. This morning, though, it remains the leading cause of cancer deaths. And joining us to explain is Dr. Mustafa Abu-Judairi, a radiation oncologist with Novant Health Zimmer Cancer Institute. Thank you so much for coming in. Appreciate it.
Thank you for having me. Appreciate it.
Yeah, this new research out shows, of course, that lung cancer is more survivable than ever, but yet people are not getting screened. So tell us, who should be getting screened under these new guidelines?
Yeah, that's a great question. So we know that lung cancer is the leading cause of cancer-related mortality, and lung cancer screening can really help reduce the risk of dying from lung cancer. So there are lots of different guidelines out there on who should get screened, but the American Cancer Society recently released a new guideline that states anyone who's aged 50 to 80 with a 20-pack-year history should get an annual low-dose CAT scan of their chest for lung cancer screening.
And that's different. That's actually opening this up to more people now.
Correct. So there's no restriction on whether you're a current smoker or a former smoker. I think it's important to define what a pack year is. So 20 pack years means if you smoke a pack a day for 20 years, or even if you smoke 2 packs a day for 10 years, then you also qualify for getting screened.
Now, the same research shows North Carolina has a higher rate of lung cancer doses than the national average. Is this because fewer people are getting screened?
So in general, there are lots of people in the United States who meet criteria for getting lung cancer screening, but unfortunately, those numbers are lower than where they should be. So really, I highly recommend people talk with their primary care doctor about whether they qualify for getting lung cancer screening.
And how do yourself and doctors with Novant Health handle these types of cases?
So typically for patients who are diagnosed with lung cancer, they're sent to our multidisciplinary clinic. It's a wonderful resource that we have here in Wilmington. It's a group made of surgeons, radiation oncologists, medical oncologists, pulmonologists, pathologists, radiologists, as well as social workers and a dedicated lung cancer navigator who all come together to help make the best evidence-based plan for our patients.
So it's really a big team of people working on you.
Absolutely. It's a wonderful team we have here.
And how does immunotherapy work for treatment of lung cancer?
It's a great question. So immunotherapy actually gets your body to help kill cancer cells. And it's really helped improve outcomes for lung cancer. We actually have some clinical trials open here in Wilmington that are actually combining high-dose focused radiation with immunotherapy with the goal of helping improving lung cancer outcomes.
All right, lots of good news to share. Let's go over those guidelines once again, just to remind folks that more people should be getting screened for lung cancer right now.
So the screening guidelines are anyone who's aged 50 to 80 with a 20-pack-year history, whether they're a current smoker or a former smoker, regardless of how long ago they quit. And those are the most recent guidelines from the American Cancer Society. And
I guess the most important thing, too, is just if you can, quit.
Absolutely. So quitting smoking can also help reduce the risk of developing lung cancer. And even if you can't quit completely, even cutting back helps.
Just reducing it a little bit helps.
Whatever you can do.
All right.
Absolutely.
Thank you so much for taking the time to come in. We appreciate it.
Thank you so much for having me.